I wouldn't have believed this to be true, but the data is in. HIV is actually on the rise, at least among young gay and bisexual men in America. Pretty scary stats. The Centers for Disease Control and Prevention found annual diagnoses of HIV among men aged 13 to 24 who have sex with men rose by 132.5% between 2001 and 2011. Quite stark from the 1/3 drop in diagnoses among the general population. Also, previous CDC studies found a 22% increase in new HIV infections among those men between 2008 and just 2010. We're talking about 2 years, 22% increase. And youth aged 13 to 24 accounted for more than 1 in 4 new HIV infections in the U.S. in 2010 alone. So HIV, aside from the occasional stories that we read about like new retroviral drugs, attempts to actually snip it out of DNA, which I read about recently. When we hear about HIV in the media recently, we hear about ways that we're fighting it. We think about sort of the increases in HIV infection rates as being something of 20 or 30 years ago. But unfortunately, for the past 10 years, without a lot of coverage, at least among young gay and bisexual men, it has been massively on the rise, which is very scary.
Right, and there are a number of reasons as to why that is. It's easily transmitted through anal sex. It's also true that young gay and bisexual men engage in riskier sexual activity. And look, in some ways, understandably so, because I think a lot of times when people use condoms, they do it because they want to prevent pregnancy. When you have 2 gay individuals, that's not really something that you're worried about, right?
Unless you don't know anything about how the body works.
Exactly. Unless you're Todd Aiken. But I think that this is the type of problem that can be mitigated significantly because we're specifically looking at young gay and bisexuals.
In some cases as young as 13.
Exactly. It could be mitigated through comprehensive sex education. However, this is precisely the type of thing that conservatives would be extremely uncomfortable educating children about, right? Totally. Because not only does it have to do with sex, which already they don't want to talk about at all, they just want to talk about abstinence, it also has to do with gay and bisexual individuals in the country. So you have to get rid of that religious right-wing ideology and think about logic and reasoning and what you need to do to actually protect these people. Yeah,
it's sad because, I mean, in every elementary school classroom, there are probably statistically 1, 2, 3, 4 gay or bisexual individuals who deserve to be armed with the knowledge that will stop them from contracting horrible diseases in the future. The idea that we should be willing to allow them to get HIV if it means that other kids won't be tricked into becoming gay, like that's ridiculous. And it has a very real toll, as we've shown with these infection rates. Now, we've got some of the specific information about why these things are on the rise. They've been summed up in charts that are available if you want to see more information on Vox.com. Now, understand that these are, in many cases, going to make the young gay and bisexual men look bad relative to straight individuals of that age. These are not about judgments. This is about information that we're trying to put out there. We're not making any sort of moral statements in these. Showing there the infection rate based on different sorts of sexual contact. Receptive anal intercourse is far more likely to cause infection of HIV than other sexual activities. Now, that's not unique to male-on-male sex, but it is far more likely. In this next chart, you're going to see risky sexual behaviors. On the right, you're seeing gay or bisexual men. And you're seeing that both in terms of having more partners and also they're more likely to have more partners, they're less likely to have used a condom, perhaps for the reason that Anna alluded to earlier. I wouldn't have actually thought of that. That was very, very smart. And then in the third one, you're going to see drug use, also a way to transmit the HIV infection. You're seeing illegal drug injections, far more likely for those who've had sex with men. And used alcohol or drugs directly before a sexual encounter, which could lead to perhaps not using condoms or doing riskier behaviors once you're having sex, more likely if you are gay in that case. And we talked about how young gay and bisexual men in particular are more likely to get the infection. You're seeing them broken down by demographic age categories there. Yeah. And you're seeing, obviously, actually between 35 and 44, for some reason, far less likely, so that's good. But unfortunately, that first bar, that should be really scary because these people are going to have to live with that infection for a long time.
It always goes back to information, education, and making sure that young people know how to protect themselves.
Yeah.
And it goes beyond the gay community. It definitely extends to straight people as well. I mean, if you look at what the Bush administration did with cutting funding for comprehensive sex education and then funneling it into abstinence-only education, unwanted pregnancies skyrocketed among teenagers at that time. Comprehensive sex ed makes people uncomfortable, but you need to do it. You have to arm people with the knowledge necessary to protect themselves.
Yeah.
And I was lucky. Look, I grew up in California where comprehensive sex ed was the norm, and I knew everything I needed to do. So I knew how to protect myself. People living in red states aren't fortunate enough to have that information.
Yeah. Yeah, and so I talked earlier about how very often when you actually hear HIV mentioned in the media, it's usually in connection with a new drug or a new procedure or something like that. And I worry, like we've covered that multiple times on the Young Turks because we want you to know that good things are being done in medicine and science and technology and things like that. But I worry that perhaps over the past 10 years, that sort of news coverage, absent talk about the rising infection rates, could lead people to believe that it's been eradicated or that it shouldn't scare you. You don't need to be safe. And it's possible that the good news is leading people to engage in risky sexual behaviors. And unfortunately, there's a downside to that. And so we're going to cover the good advances in terms of the medicine, but we also want to cover the fact that this disease that many people probably think has been wiped out has not. It's scary.